We all know Jacksonville's a military town, so we're all very familiar with the Department of Veterans Affairs and what they traditionally provide veterans. However, you might not know that they have what's called the VA's fourth mission. And if you're wondering what it is, we have the answer for you here with Dr. Jennifer McDonald. She's the Chief Consultant to the Deputy Undersecretary for Health. She's joining us today. Doc, let me start with this. Tell me what this fourth mission is.
Well, VA is very well known for delivering health care, benefits, and memorial services. What's not as well known is our fourth mission, as you said, to support the nation in times of national emergency. Oftentimes that means supporting during a hurricane or a flood or a fire. Even now, we send in our personnel, we send in our mobile pharmacy units, we support via telehealth to keep people safe. And during the COVID-19 pandemic, that has meant growing our efforts in unprecedented fashion and working alongside our federal partners to support 47 states, the District of Columbia, and tribal communities during this time. As a veteran and a physician, I am incredibly proud of what we're delivering.
That's a lot of people to support. So how is the VA continuing to serve veterans while balancing this fourth mission?
Veterans are always our first priority. And it's really thanks to early planning and continued active planning that we've been able to use the agility and the breadth of our system, and again work alongside our federal partners to continue to deliver excellence for those we serve, and then go above and beyond and be able to support communities across the country. That has been extremely rewarding on both fronts.
Now, how does the VA determine which communities receive this help?
Typically, those communities, those states, come to us, to the federal government. And VA works alongside the Department of Defense and the Public Health Service to determine who can best support. And then we work closely with governors, with senators, with states themselves and their health departments to determine how we can meet that need and how we can support those communities and those veterans and civilians.
Now, Doc, what are some examples of the VA assisting local communities, and how does this help and protect American citizens, veterans, and their families?
Well, one is in Kansas, when there was a hospital that made an emergency request for ventilators late on a Saturday evening. VA was able to get those ventilators there within 4 hours. In Florida, when community nursing homes needed support for patient care and infection control, VA sent more than 200 of our staff in, volunteers who raised their hand and said, "Send me," in 15 teams to support those community nursing homes. And we estimate that in collaboration with those partners, we reached more than 8,000 patients. And one more I'll mention is supporting the Navajo Nation. When we realized that that community was tragically hard hit by COVID and needed our support, again, our volunteers raised their hands and worked alongside those clinicians to make sure that they could help build the community's resilience again and help people heal.
Well, what else should we know about the fourth mission and how the VA is responding to the pandemic?
Well, I just want to speak as a veteran to the veterans who may be listening. We want you to know that VA is here for you. We know you're resilient. We know you're taking care of others during this challenging time, but we want you to know that when you need care and support, we are here. And same to states and communities. Alongside our federal partners, we will be at your side when and if you have a need.
I really appreciate your time today, Dr. McDonald. And folks, we're going to put this on our website like we do every day, where you can check it out again at firstcoastliving.net.